Introduction: raised blood pressure is a serious warning sign and a silent killer that rarely causes symptoms. It is one of the key risk factors for cardiovascular disease and fourth contributor of mortality worldwide. Yet it can be prevented as it is a modifiable risk factor. Heartfulness meditation is a form of Raja Yoga and is one of the simplest method of non-pharmacological practices that has been proved to be cause reduction in sympathetic drive and improves the parasympathetic activity and finally leads to the body and mind relaxation. Introduction: hypertension causes the increase in peripheral vascular resistance, which leads to increased cardiac work and myocardial oxygen consumption. Rate pressure product is a reliable index of myocardial oxygen consumption and can tell us vascular reactivity. Vascular reactivity can be observed by isometric stress. Aim and objective of the study: to study the effect of heartfulness meditation in modulation of cardiovascular response in hypertensive patients to stress. Objectives: to study the effect of heartfulness meditation practices, SBP, DBP and mean arterial blood pressure and pulse pressure, heart rate and rate pressure product in hypertensive patients. To assess the effect of heartfulness meditation practice on cardiovascular response to stress induced by isometric hand grip test. Materials and methods: it is a prospective study, self-controlled study, and done in SWIMS Hospital, Tirupati from 2019 June to 2019 September. 100 known hypertensive patients who attended to the OPD of the Cardiology Department of Sri Venkateswara Institute of Medical Sciences, Tirupati, Andhra Pradesh, a tertiary care and teaching hospital. Materials and methods: inclusion criteria: known hypertensive of either sex aged between 30 to 60 years were included in the study. Inclusion criteria: hypertensive patients age less than 30 and greater than 60, and with other comorbidities like diabetes, coronary artery disease, and renal failure, epilepsy, and asthma. Pregnant women, patients practicing any form of meditation on basis prior to the study were excluded. Materials and method: regulatory clearance. This was carried out approval of the IEC committee of our institute, and study procedure: patients including data including age, gender, body, BMI, systolic BP, diastolic BP, pulse pressure, mean arterial blood pressure and rate pressure products were collected. Materials and method: blood pressure recording SBP and DBP were calculated with a calibrated sphygmomanometer in sitting position after 5 minutes of relaxation. 3 readings were collected by giving 3 minutes of time interval, and the average of 3 readings were calculated. Other parameters were calculated below. Pulse pressure, mean arterial pressure and rate pressure product were recorded. All these parameters were recorded before, during and after 2 months of heartfulness meditation. The response of IHG test was measured before and after 2 months of the study period. Materials and method: isometric hand grip test. Isometric stress was produced by performing IHG test using a hand grip dynamometer. The patients were asked to sustain the hand grip for 1 to 2 minutes, and after which BP and heart rate were measured. Heartfulness meditation intervention: all the patients were made to practice the key elements of heartfulness meditation: relaxation, meditation, and cleaning and prayers. For the first 3 consecutive days for the duration of 1 hour under the guidance of heartfulness meditation trainer. They were asked to follow the meditation guidelines daily for 2 months. They were asked to attend weekly follow-ups. Statistical analysis were performed by SPSS version. And research findings: age and genders: the 30 to 40 group are 10 included in the study, 41 to 50 33 patients, and 51 to 60 57 patients. In gender wise, females are 57% and males are 43%. Baseline characteristics and distribution of the study by demographic and independent variables like physical activity, dietary habits. Majority of them are non-vegetarian, 73%, and smokers 4%, alcoholic 6%. Patients along with other comorbidities like diabetes in 12%, and patients with kidney disease 4%, and all other patients are having hypertensive medication. Comparison of parameters at the baseline, during weekly follow-ups, and end of the study. During the first week of the study, SBP is 120 on the baseline, and during the end of the study, it is almost 103 plus or minus 8.7. DBP also decreased by 5 points, and heart rate also decreased, and pulse pressure also decreased. These are the at baselines and at weekly intervals. Comparison of the parameters of SBP, DBP, heart rate, and pulse pressure all are comparatively decreased at the end of the study. Comparison of all these parameters at rest and before and at the end of the study. The baseline patients, even though before they are controlled with the antihypertensives, and at the end of the study, all the patients having reduced dosages of the drugs and number of pill burdens. Cardiovascular response to IHG test before and after heartfulness meditation training for 2 months. This is the baseline characteristics and end of the study. The SBP, DBP, heart rate, and all those things are decreased at the end of the study. Even with the IHG test, also at the end of the study, the parameters are decreased. Discussion. This was compared with the previous study which was conducted in Jipmer Vijay Lakshmi et al. Study, which was a 4-week study. It is also prospective study, and sample size when compared to that Vijay Lakshmi et al. Study. This is the present study having 100 sample size, and including with both sexes, both genders has been taken. Discussion. Intervention in the Vijayalakshmi et al. Study was the yogic relaxation practices for 60 minutes daily, including the asanas, Naukasana, Viparita Pakasana, Matsyasana, and Shavasana with Kaya Kriya. In the heartfulness meditation, relaxation and meditation, cleaning and prayer, which is easy and anybody can do, which are having arthritis problems also. Discussion. Response to IHG test in the Vijay Lakshmi et al. Study and present study comparatively, both showing the positive results with the IHG test with the meditation and yoga practices at the end of the study. Limitations of the present study. It is a single center study. Sample size is relatively small. Randomization was not performed, and patients were given meditation intervention and followed up for only 2 months. Baseline blood pressure parameters are normal, as the present participants are known hypertensive and they are already on the standard medication. Further study may be required with the study participants of uncontrolled hypertension or enrolling newly diagnosed hypertensive patients. Conclusion. Heartfulness meditation practices as a complementary adjunct to the medicine in hypertensive therapy produces overall relaxation response and reduces blood pressure and heart rate. It can reduce the myocardial oxygen consumption and decrease the workload on heart. It can also optimize the sympathetic response to stressful stimuli like isometric hand grip test and restores the autonomic regulatory reflex mechanisms in hypertensive patients. Thank you.